Core Measure 9 records smoking status. The objective of Core Measure 9 is for providers to record the smoking status of their patients 13 years or older. The measure requires that more than 50% of all unique patients 13 years or older seen by the provider within the reporting period have their smoking status recorded as part of the EHR structured data. Within Prognosis, this would be under the social history templates. The requirements for attestation are a denominator, which represents the number of unique patients aged 13 or older who were seen during the reporting period. Now, this is similar, you'll recall from the other videos, to many measures that are looking at unique patients, which means it is a chart-driven or chart-level history of the patient and not encounter-specific. So whether your patient is seen once or multiple times during the reporting period, it is getting counted only once. The numerator represents the number of patients within that denominator who actually do have their smoking status recorded. And again, since this is at the chart level, once you have entered it for the patient on their face sheet through social history, it is there forevermore on all of their other visits. The only exclusion that CMS has provided under Core Measure 9 is for any provider who does not see any patients 13 or over during the reporting period. So if you happen to have a young patient population and none of them during your reporting period is over the age of 13, then you can exempt yourself from Core Measure 9, and during attestation you would simply enter a 0 in the exclusion box. Now, something to keep in mind with regards to Core Measure 9 smoking status is it is different from the NQF 0028, which is a tobacco use cessation education that we're going to see under clinical quality measures. So a lot of providers have had a little bit of questions there, thinking it was the same thing, and it actually is not. Core Measure 9 is simply asking basically yes or no, does your patient smoke? Some patients are going, or some doctors are actually going beyond that and getting a little more detailed, but it is different than the clinical quality measure on smoking. So we're going to go into Prognosis now and take a couple of minutes to look at our social history with regards to the smoking. So on our face sheet, we're simply going to go into our social history, and you're no doubt aware that social history is template driven. So in our test database here, I show you we have a few different social history templates by default. We have one called General, we have a couple of adult templates, brief or detailed, and we have a pediatric template. Based on your specialty and your patient population, you may have even more than this. You may have a variety of social history templates, and that is completely fine. But in order to be compliant with Core Measure 9, you do have to record the smoking history of your patient. If you have multiple templates that you're using, and you happen to have multiple questions, a different question for each template, then all of those questions must be defined within the system properties to give you credit. Similarly to what we covered in Measure 8 under Vitals History, there is a system property where all of your test codes are defined. For instance, we're looking here at our General Social History template. And if you've looked down the screen in the middle here, we have a question simply called Smoking History. And if we double click that question, we will see that our code is SH for Social History 20399. So 20399 is one question. However, if we go and look at one of our adult templates, where there is also a smoking question, notice here that the question is a little different. This one is not called Smoking History. It's called Do You Smoke or Use Tobacco? And it has a different code in it. Now, there's nothing wrong with having two questions like this with different codes, because based on your needs, you may ask the question a little differently. You just need to remember that both of these codes be defined under your property. Because thirdly now, we can even look at our pediatric template, and we will see yet a third question within this practice. And this one is actually just called Tobacco Use. And if we open that, we will see it has even yet a different ID. So all of these test codes that we use are fine. We can use whichever one we want or any combination of them as long as they are all defined at the system level. So I'm logged in as Dr. Cooper. Everybody with clinical access will have this right under their settings configuration menu. When meaningful use is turned on within your practice, these should be defined by default for you. So this isn't something you need to worry about doing, but just know in the back of your mind that if you happen to run your meaningful use report and your smoking status is falling short of the required 50%, it could be because one of those questions that you're answering has not yet been defined in the property. And this way you would know how to fix that. So under our admin column, we're going to go into properties. And even though this is under our social history, the property at the system level is stored within the vitals category, where all of our other properties are that we talked about in Core Measure 8. So when we open our vitals property, you will notice here in the smoking test code, all of those questions we just looked at are defined here. So it is a comma delimited list, and you can have however many questions that you are utilizing back on your templates. Just make sure they're defined here so your meaningful use report is able to capture them. Now as we go back to our test patient, we'll just go ahead and answer, regardless of which template, since they're all covered, I'm just going to go ahead here and answer his smoking history as a never and save it. And if you verify back on your face sheet, there his smoking history is stored. The question has been defined in the property, so you will be counted as compliant for Joseph Randall. So as a summary for our compliance checklist, we want to make sure that all of the test codes that we use are defined within the property. If you're using multiple templates, again, it could be a comma delimited list. We want to remember to select the appropriate template for our patient, keeping in mind, again, this is only for 13 and over. Enter the smoking status, and remember that this is not the same as the tobacco questions that you will encounter under Clinical Quality Measure 10. And then you want to save the template.